My name is Larry Hoffheimer. I am the founder and chairman of the Macular Degeneration Association. I'll give you a little background on how this organization came about and what my role has been and why I'm so enthusiastic about these webinars. First of all, my mother had uh, wet macular degeneration and lost her vision in both her eyes more than 20 years ago. At that time, there were not, they did not have anti-VEGF treatments, so there was nothing she could do except lose her sight. She was a voracious reader. She couldn't watch television, and she couldn't even see her family. So I became very intrigued, having spent a career as a healthcare attorney in Washington, D.C., and I represented a lot of patient advocacy groups as well as doctors and other healthcare providers. So when I started this organization, I wanted to do it to try to educate the millions of people that are suffering, in this case, from macular degeneration, better known as AMD, age-related, which is, I'm sure you must know by now, is the leading cause of legal blindness for people over 60 years of age. When I started this organization, I became very familiar with the signs of macular degeneration. And lo and behold, about 2.5 years ago, I ended up with wet macular degeneration. I had no symptoms whatsoever until one day I noticed a jagged uh, door jamb in my office. And I immediately went to a retina specialist. And the next day I had my first injection. The good news is I still have 20/20 vision, which not many people with wet macular degeneration can say. So I've been very fortunate, and what you're going to hear today is going to help you both in the early diagnosis and the early treatment, which is critical. And you're going to hear about a lot of things you can do to maintain good vision. Uh, so we have two very exciting speakers today. But I want to tell you, we're doing a whole series. We're doing a whole series of webinars for patients, as well as optometrists and other doctors. And one of the things we like to do is, if you go to our website, which is Macular Hope, one word, macularhope.org, you will see uh, the series of webinars that we will be hosting going forward. The Macular Generation Association is a charitable organization. It's tax exempt under the Internal Revenue Code, and we raise money for thousands of people all over the country. We also get support from pharmaceutical companies, particularly the ones that make anti-VEGF drugs. So I want to begin by thanking Novartis and Regeneron for their support, and Notovision, which you'll hear from shortly, that are sponsors of this program. As far as Notovision is concerned, and I've said this to Megan, is one of the most important ways of diagnosing early uh, macular degeneration, as it does much better than the AMSLA grid. So it's very important that as many of you as possible, particularly if you have dry macular degeneration, that you consider that. And you'll hear more from Dr. Blinker. Our first speaker is Dr. Dorothy Hitchmoth, who is an experienced doctor of optometry and has been seeing patients in the Dartmouth Lake, Sunapee region for 25 years. She believes vision loss can be largely prevented, and her philosophy of care starts with the belief that a healthy body lends itself to a lifetime of good vision. Dr. Hitchmouth is nationally recognized award-winning doctor, professor, and lecturer an educator. She has extensive ophthalmic industry experience and has been involved in healthcare policy and management. It's now my pleasure to turn this over to Dr. Hisbeth.
Hi, thank you so much. So excited to be here tonight, and hopefully we'll share some information. And if that information helps just one person, I'll consider this night a success. I'm going to just start my presentation here momentarily, and we'll get started. So hopefully you can all hear me. And just like Larry said, saving eyesight one person at a time is my mission. Really, we know and have so much science around not just macular degeneration, but other conditions that cause vision loss that tells us that vision loss is not inevitable if you do indeed develop an eye disease. And that's very, very exciting. And it's exciting that we've really had come along in leaps and bounds in the last couple of decades in that regard. So just a couple of disclosures. I do work with various companies along my pathway towards prevention of vision loss, and those are listed here. But this lecture was certainly developed by me without influence. And just a little disclaimer, the information in this presentation is general. I really want you to make sure that you see your eye doctor for individual advice, even if I describe a situation that sounds exactly like you. And, I have a personal story too. This beautiful lady in this photo, these are my grandparents, but the lady is Amelia Bonanno. And I want to dedicate, the discussion tonight to her. She had 10 children. She gave birth to 10 children in her own home. And for that feat alone, she should be awarded. She had a wonderful life. She was a great grandmother, affectionately known by all of us as Nana, but she lost her vision to both diabetic retinopathy and macular degeneration in the last years of her life. And really was the inspiration for me becoming an eye doctor, because watching her go through that process, I thought, my gosh, there has to be a better way. Now, that's over 30 years ago that I'm referring to, but here we are. So my objectives, as you can imagine, for tonight are that those of you who are listening learn something new. Secondly, I want you to help me evangelize about the importance of regular eye care and how to avoid vision loss. And we're going to talk about that tonight. Just going to start with a few facts that many of you may know already. Your local eye doc, your doctor of optometry, we see patients of all ages and often throughout a patient's lifetime. We're truly in the business of improving and preserving vision, and we regularly identify those at risk for vision loss and other health problems. And I would like to believe it is our job to not just save vision, but also life. However, I think it's really important for patients to understand how to identify their own risks, understand what their pathway, their visual pathway may be as they go through life. So we're going to just start with some really basic information. To me, it seems basic, but I'm regularly kind of shocked that even pediatricians and other primary care docs don't always exactly know what the recommendations are for a comprehensive eye exam. So I would love for patients to go in and tell them or tell each other, whatever, as long as the information, gets out there. So essentially, we recommend that babies get at least one comprehensive eye exam before their first birthday. For children between 3 and 5, at least another additional eye exam, and certainly again before first grade and every year of school after that. Now, if a child has been recommended as high risk for some reason, and I'm going to talk about that, they may need to be examined more often. But the critical time is that once before birth, because that serves as a baseline. Now, who might be at risk? Some of this may be obvious, some of this may not be obvious. But if you're a grandma or a grandpa or even a parent and you're listening to this presentation, if you had a premature baby, they should be examined before their first year of life and throughout their life. If there is a family history of myopia, also known as short-sightedness or nearsightedness, or amblyopia or crossed eyes, or loss of development of vision in one eye, cataracts in young children, or unusual genetic diseases. If mom had an infection or any kind of difficulty during her pregnancy, or used alcohol or drugs or smoked, if mom had a difficult labor, if a child hasn't been examined and they're having trouble at school, that should be one of the first evaluations that they have, even if they didn't previously have a visual evaluation. And all children with diseases in their body that have been identified should also have an eye exam, as I recommended. And certainly, as you can imagine, children or young people who've had previous eye surgery, or even an eye injury, or an injury that caused them to lose vision, they have only one spare left, and that they have to go a lifetime protecting that other eye. And then, of course, there are certain medications that can put you at risk. So why do we recommend, I should say, that children have a vision exam, an eye exam at such an early age? Well, one of the most important reasons, is that there are a pretty large percentage of children, as many as 4% of children, so that's 4 in 100 children, develop a condition known as amblyopia. And this condition sometimes can be seen or detected by a parent, or a provider, a pediatrician, or an eye doc, but sometimes it can't without a comprehensive eye exam. Children's eyes, just like these two perfect looking children in this photo here, can look perfectly normal, yet that perfectly normal, perfectly navigating, seemingly perfectly sighted child can have loss of vision or lack of development of vision in one eye. Now, the baby in the larger picture with the blue eyes, you may be able to notice that one eye is turning in, but that is not the circumstance under which many of these children develop this condition known as amblyopia. So this is why we recommend, because of that number of patients that can go for years not knowing that they have that. In fact, it's not just that condition, but the U.S. Preventative Service Task Force believes that somewhere between 1% and 5% of preschool age children in the United States have some sort of vision impairment that is not correctable by glasses. And that's the key here, not correctable by glasses. You know, we all know children, young children, older children that wear glasses and their vision is corrected. And that's a wonderful thing. I fell into that category at a really young age, and I'm so grateful that my vision is still correctable to 2020. But it's the children who have these other conditions that can worsen and that haven't been identified. Is really important that we figure out who they are. And to that effect, the American Optometric Association, in association with other charities, has long ago developed a program called Infancy. And I want all moms of babies to know about this. So, spread the word about this program, because doctors, eye docs across the entire country have signed up and committed to provide free eye care for all babies, comprehensive eye exam under the age of 12 months. So no matter what your means, no matter what your insurance, this is a service that's available, and you can access that service by going to infancy.org. This program really gained some traction years ago when it was developed, because former President Jimmy Carter has 2 children with amblyopia. So he continues to be very helpful in promoting this program. But I would love for all of you listening to the webinar tonight to make note. And if you know someone who's about to have a baby, or has a small child, or have your own grandchildren, let them know about this program and make sure your baby's eyes are examined. And not just as babies, but children need to have annual eye exams. Why? Because their visual system is continuously changing. Just like their body grows, their eyes grow, how their eyes relate to one another, sort of eye teaming, and how their eyes develop along with their brain changes each year through the age of 18 and sometimes beyond. And many of you may know that 80% of learning occurs through the vision or through your vision. So it's important to make sure as that child develops, they're not developing some other eye teaming or other visual problem as they develop, because it can change. So it's not just making sure you do that comprehensive exam as babies and young children, but throughout their school years. And good Lord knows the visual stresses on the eyes have changed. These two scenes are not all too uncommon to me, and I'm sure to many of others on the line here. But, when I see babies holding cell phones, you think, oh my God, is this crazy? Or is this just the way the world's going to be? And I think it's going to be the latter. And we just have to be mindful and think about how we allow our children to interact with devices, and also make sure that they're getting examined so that there's not additional stress or damage to their eyes that can affect them for a lifetime, to include whatever their avocation may be, which is likely to be engaged with a device, given the way that the world is changing. So for adults that have no symptoms, so I'm 18 years old, or I'm 25 years old, or 30 years old, when should I get my eyes examined? If everything seems fine, I don't have blurry vision, everything's hunky-dory, well, at least every couple of years between the ages of 18, right, and through your older adult years, or, and this is a big or, every year if your doctor recommends that. And if your doctor your eye doc is recommending, or your primary care doctor is recommending that you have an annual eye exam, there's usually a really good reason for that. There's usually a risk factor that you have, or a higher risk for developing a vision problem throughout your life that he or she has identified. Now, if you're over 65, all bets off, because we know that most vision robbing conditions tend to occur as people age. It becomes more important as you cross the age of 65 to get your eyes checked at least annually. And it may be that you need to get checked more often even than that. So really important that even if you have no symptoms at any of these ages, that you're making sure that eye care, going to the eye doc, is just a regular part of your health and wellness. Because vision loss stinks and it can be prevented, right? So who are the people that are at risk that actually may need to be seen more often? Well, certainly, just as Larry said, if you have a family history of an eye disease, it's likely you've inherited some piece of that risk. There are certain racial and ethnic groups that have a higher predilection for certain types of diseases, and I'm going to go over some of those tonight. There are certain types of health conditions that can cause problems in the eyes. I think a really obvious one, well, maybe not so obvious, is diabetes. A lot of people are talking about diabetes. If you have a high-risk job, you should make sure you're getting your eyes checked. If you're taking certain types of prescription medications, one specific medication that's widely prescribed for a number of rheumatological conditions is Plaquenil, also known as hydroxychloroquine, which of course has gained fame during the COVID pandemic. But despite whether we think it's useful for that particular condition, the reality is there are many, many people on that medication. And if you're on that medication for a long time, it can affect your vision. And often the vision changes from that can actually be can be permanent. So you definitely want to make sure that you're getting checked regularly. If you have vision in only one eye, if you wear contact lenses, especially 24/7, and you don't go get your eyes checked, make sure you're doing that. If you've had prior eye surgery, right? So patients who've had prior cataract surgery and LASIK, smile procedures, you might come out the other side of that with really good vision, which is amazing and awesome, but it doesn't mean that you're immune from that point forward to developing other age-related or what we call degenerative eye conditions. So make sure you continue to get your eyes checked. And not just screen. And this is the really important point. As you can imagine, I'm completely biased. Do I think you should go, and go up to an eye chart that's on a wall, cover one eye and say, oh yeah, I can read down to the 20/20, cover the other and call it a day, your eye exam is done? No, really, to have your risk sorted out, to have every structure of the inside of your eye properly evaluated, you need to see an eye doctor. So only a doctor of optometry or an ophthalmologist, those are the only two types of eye doctors that there are, can conduct a comprehensive eye and vision exam. We have special tools to do this. More and more, some of those tools are allowing us to help you take care of your own eyes through the computer and through home. And we're going to talk about that tonight. But really, you need to get that checkup at the doc office, at the eye doc office. Not only that, but I think what a lot of people really, really don't know, this is not common knowledge, that there are over 250 diseases of the body that we may actually see in an eye exam. Your pupils are little holes. I joke about that all the time. That we can look through. And when we look through that hole, there are all kinds of things that we see. I call them biomarkers or indicators that you may have a whole host of diseases. Now, not every single one of these diseases will show up in the eye, but certainly it's an opportunity to help the greater healthcare system identify people often at very, very early stages of the disease that they may have in the body. In fact, there are a number of studies that show your eye doctor is often the first to diagnose a body disease in as many as 5 out of 100 patients. So that's pretty amazing and profound. Lots of people will ask me, what are you seeing? What do you see when you look in that, thing that you're looking at, that microscope or that instrument? You would think after almost 26 years of practice that, maybe this would get boring or, same old, same old. I can tell you it doesn't. I just think this is just one of the most amazing organs. It's a very privileged thing to actually look into the eye and see what's going on with someone's health, because there are so many structures in the eye that connect to the body in different ways. Some of the basics I'm showing here. So, the front of the eye is known as the cornea. The colored part of your eye is known in the iris. And of course, as most people know, the little black dot there is your pupil. And behind the pupil is the natural lens of your eye. So the lens in the eye, as when you're born or when you're young, or if you haven't had trauma to the eye, is clear, like a beautiful brand new windshield on a brand new car, if you've ever had the privilege of looking through that. As you age, that clear lens, it's like a piece of glass, actually develops a little bit of opacity, or it becomes cloudy. And that's what we call a cataract. As many of you may know, and I suspect there's many people on the webinar tonight who have had cataract surgery. And it's a wonderful thing that we have access to cataract surgery, especially in the United States. But I would be remiss if I didn't mention that cataract is still the leading cause of vision loss worldwide, because people don't have access to regular health care and to eye care. So worldwide, cataract is a really significant and devastating condition. But certainly here in the United States, we enjoy the benefits of having access to cataract surgery. When you get past the lens, the inside of the eye is a jello-like substance called the vitreous, and the back of the eye in totality is known as the retina. And there are many, many layers to the retina. There are blood vessels that go throughout the retina two different sets of blood vessels that actually flow from two different parts of your body. And of course, there's the optic nerve. This is the nerve that gives you vision. It allows you to see. And that nerve has 1 million fibers packed into the size of a pencil head that actually literally wraps all the way around your brain. And so as you can imagine, that's why many, many conditions in the brain are detected or may be detected on an eye exam, such as strokes and tumors. So that's what we're seeing when we look into your eyes. And, I think that the next question is, I know you're looking at the front of your eyes, and I know you're checking my vision, and I know you're looking at the back of my eyes, at the retina. These are just two representations of what we actually see under the microscope. The bottom picture is that little white dot there is your optic nerve, and that's that 1 million fibers. And all of those blood vessels or the red lines are actually blood vessels that come straight up from your heart. So you can imagine eye docs get a glimpse into your cardiovascular health. We do this every single day, and it's amazing what we can see. I always say that the eye-brain relationship isn't a relationship. It's really one thing. Your eyes are merely an extension of your brain, and it's a piece of your brain that we can examine with special instrumentation, unlike the brain. Although, of course, we have MRI and all these, amazing technologies that allow us to examine what's going on inside the skull. But really, for the general population, the eye exam is one of the ways that we get a glimpse of your brain and some of the function there, as I stated earlier. And that includes, even identifying things like Alzheimer's or Parkinson's disease or other conditions of aging that happen in the brain. What else do we see? There is this eye-heart relationship. The image on the right that looks like a whole bunch of spaghetti in a tube is actually a real angiogram of a human. And the angiogram shows how complex the blood vessels are as they travel up into the eye and the brain. So really, there's no separation, as I said, between your heart and your eye. And again, there are many cardiovascular or heart or blood vessel diseases that we can see when we look into your eyes. My father is long passed, but this is a picture of his retina. And many years actually before he passed, I looked into his eyes, and what I saw, and you may appreciate this, it's a little hard to see, but there's a tiny little red dot sort of in the center next to the white optic nerve that's there. And right next to that, which I know you cannot see in the image, is a little blockage on one of the blood vessels. We went to then find out after I saw this, and I knew as an eye doctor, this was a marker for coronary atherosclerosis or hardening of the arteries. And sure enough, it was found that my dad actually had very significant hardening of the arteries. So it's really important. And you may experience your eye doctor actually saying, hey, I'm going to send my note over to your primary care doctor or to your cardiologist because there's this little sign in your eyes that you may be at a significant risk for a heart attack or stroke. And that could be life-saving. That's one of the most gratifying privileges that I have as an eye doc is being able to say, hey, you know what, you're feeling good today, but let's keep it that way. Really, really a privilege. There are a lot of other eye-body relationships, or that's what I call them, eye-body relationships. For example, the thyroid in your neck is made of a certain type of substance or a tissue that is the exact same tissue that cushions your eyeballs as they are sitting in your head. I think a lot of people don't know that. You may hear things like, oh, your eyes can be affected by thyroid disease or a condition called Graves' disease where there's bulging of the eyes. But this is literally the same tissue in your neck as you have around your eyes. So anything that goes wrong with that thyroid most indefinitely, actually, and sometimes often will show up in the eyes first. And then there are the more obscure relationships, that, and this is just an example. There are many other eye-body relationships, but this one I think is a really interesting one, and one that most people and most doctors are actually not aware of. But there's actually a birthmark that can show up in the eye. The birthmark, a picture of that birthmark is in the lower picture. It looks like kind of a cigarette burn. That actually, if it's that big, can be an indication that you have a very specific inherited colon disease that puts you at very, very high risk for colon cancer. So who knew that having an eye exam might identify a problem in the colon? That old adage, the thigh bone is connected to the knee bone or something like that. With the eye, it's actually really, really true. So again, why should I get my eyes examined? I suspect that everybody on the call tonight already knows why. And again, I hope I'm giving you just a few tidbits of what you can tell other people to help them and to protect them. The reality is the leading causes of visual impairment and blindness are largely preventable. That's an amazing fact. And it's something that I mull over in my head over and over again, because it really took me a long time, even as a doc, to understand what that meant and what information I wanted to share with the world, right? To make sure that people don't unnecessarily lose their vision. So let's look at some facts. Obesity, diabetes, poor diet, lack of exercise, and smoking are associated with the leading causes of vision impairment. By the way, they're associated with the leading causes of death. So, different condition, bad outcome both ways, right? So, obesity, diabetes, poor diet, lack of exercise, and smoking. We generally know these are not great things, right? Also, the rate of obesity, diabetes, and smoking in the US is a lot. It's a lot. So if you think you're not at risk, for example, from diabetes, think again when you think about these numbers. There are at least 40 million people who have diabetes. About 10 or 11 million of those people don't know they have it. They have not been identified yet. There are approximately, depending on which numbers you look at, 88 million people with pre-diabetes. So this is well over a third of our nation. Americans are topping the scales, crossing the line of obesity at 42%. And despite the smoking rate coming down, which is fabulous in the last 10 years, there are still about 34 million smokers in the United States. The rate of obesity is a lot. The rate of diabetes is a lot. In some states, in the central, south, and east, the rate of diabetes and obesity is tipping towards 40%. The rate of smoking, as I mentioned, is getting a little bit better. If you look at the statistics here, we've the numbers look better looking between 2000 and 2014, but we still have a long way to go. Not every group, there's disparity also. I think it's really important for me to point this out, that there's disparity in smoking, right? The who smokes and who has and why they smoke, I don't know. This is a public health dilemma. But the reality is that there are more Native American, African American, Hawaiian Pacific Islanders, and whites that smoke than certain other groups. The rate of blindness, as you can imagine, is also increasing. Again, like I said a couple of slides previously, obesity, diabetes, and smoking are some of the things that lead to vision loss. And so as you can imagine, as the numbers of all those maladies goes up, the rate of blindness is going up right along with it. So what can we do? What can we do? What can you do? How can we educate people? What can we do to help our own family members And sometimes it's hard to help your own family members. And I understand what that's like, but you can help people identify their own risk, right? So you are at risk for diabetes if you are overweight, if you're over the 45, if you have a parent or sibling that has type 2 diabetes, right? So, I'm sort of in the normal weight range, although I'm pushing the limits with COVID. I'm certainly over 45. I did not give birth to a baby that weighed over 9 pounds and did not have gestational diabetes, but my mother has had type 2 diabetes for 40 years. My younger brother has had diabetes for 6 years. So that puts me at a higher risk than all of the other things combined. So having that primary relative with diabetes is a very, very strong indicator that you have the genetics, the genetic risk for developing that disease. Yes, you can fight it every step of the way. And that's what I'm doing every single day, even though I'm looking around because usually there's at least one piece of chocolate on my desk. You can impact the course of even diabetes and even reverse it. So knowing that risk is super important. If there are even the CDC, the Center for Disease Control, has some great little tools, little computer tests that you can use. And I put some of those here. The link to that is here. By the way, all of the other references to all the data that I'm providing in this presentation is available upon request. So please feel free to request that. I think I may post this on my LinkedIn tomorrow so that people can access if they want to go back and reference something. We do have a question and answer period coming up as well. So macular degeneration, again, who's at risk? If you're over 60, you're at risk. If you have a family history of macular degeneration, you may have as high as a 40% higher risk of developing macular degeneration. Again, not inevitable, but you need to know that your risk is higher. Right. And, I'll hear a lot of patients say things like, oh, yeah, my dad had diabetes, but, it was old age diabetes. No, you are at risk. There is no such thing as old age diabetes. Yes, there's type 2 diabetes, but if your dad had it, you're at risk. Okay. That's just the way it is. That's your genes. Be aware of that and understand that. So same thing with macular degeneration. If you smoke cigarettes, your risk of vision loss from macular degeneration goes up precipitously. So in other words, the worst thing you can do if you have a family history of macular degeneration is smoke. If you are overweight and you have a risk, your risk of vision loss goes up. If you have high blood pressure and you're at risk for macular degeneration, your risk goes up. Another important fact to know is that as many as 15% of Caucasians over 75 have this condition. That's a lot of people, right? And as Larry said in the introduction, it is the leading cause of vision loss in people over 65. And we have the tools to mitigate this vision loss. That's the miracle that I want to talk about really tonight. Glaucoma. Who's at risk for that? Well, if you've ever been told that you have high or slightly high or a little bit elevated eye pressures, you need to make sure that you're going back and getting that checked. Even if your doc says, oh, well, it's kind of high, but maybe it's not so bad, you still need to go get checked. Why? Because that can change over time. Again, people over 60, there's a higher rate of glaucoma. If you are African American, Asian, or Hispanic, your risk is much higher for getting glaucoma. Whereas in macular degeneration, if you're Caucasian, your risk is much higher for getting age-related macular degeneration. If you have diabetes, heart condition, high blood pressure, or sickle cell anemia, your risk for glaucoma is higher. And if you've ever been told you have thin corneas, that's not a routine test with your eye doc, but if someone has measured that, that should be something you should pay attention to. And you should ask your doc, are you checking that because you think I might, be at risk for having glaucoma? And certainly if you've had a prior trauma to your eye or a type of inflammation called iritis or uveitis, you may be at a higher risk for developing glaucoma. And I would add too, if you're of Afro-Caribbean descent, your risk of glaucoma is one of the highest. Whether you're a native or an of Afro-Caribbean descent living in the United States, you should really make sure that you're getting your eyes checked and having glaucoma ruled out, because just like many of the other conditions that cause vision loss and blindness, there are no symptoms of these conditions in their earliest stages, when is exactly when we can work to prevent the vision loss from those conditions. Diabetic retinopathy, are you at risk for developing this? Yes, of course, if you have diabetes, but how long you've had diabetes matters. How well you control your blood sugar matters. How well you control your blood pressure, your cholesterol, and whether or not you smoke matters. Your genes matters. Again, African Americans, Latino Americans, and Native Americans are at a higher risk for developing diabetes and therefore diabetic retinopathy. And the population studies show that those groups are developing retinopathy sometimes even decades before the average onset, if you just put everybody into one big bucket. So those are special groups that really need to pay attention and make sure that they're seeing their eye doc. If you know people in those groups or you live amongst them, I'm sure there are people in rural areas of the country, in city areas, who knows? But if you're out there and you touch any of these populations or understand or are part of those cultures and that populations, evangelize, let people know, you really need to identify whether or not you have diabetes as early as possible. You can do something about it. Can you take a risk test? Yes, you can. This is one of my favorites. You can put in your height and your weight and some other general information, and you can get a risk score. Again, do I have diabetes? You can actually just type that in your Google search taskbar or whatever search engine you use. Do I have diabetes? And it should pop right up. So I'd encourage you to take that. If one person takes that test and self-identifies as a result of this lecture and has maybe not news that they want, but has a better outcome, boy, I would just be so happy about that. So I'm going to just take a short timeout, not an actual timeout, what I call a really bad food timeout. If you eat fake fat, and that means trans fats, fat that is put into a lot of the prepared foods that you can buy in the grocery store, cakes, crackers, basically anything that's in a package, and you don't eat fruits and veggies, you're headed for a disaster. Why? Because these bad fats and the lack of fiber in the diet literally directly leads to a condition in the stomach that leads directly to diabetes, both type 1 and type 2, and can actually make them worse. So it's not just a matter of, you need to go eat more fruits and veggies and don't eat so much sugar. It's don't eat all that bad fake stuff, right? And so you've heard this from cardiology, potentially. You've heard it from all the famous doctors, Dr. Oz on TV and Dr. Kellyanne and all these different groups talk about, get rid of these bad fats, these trans fats. Well, there are real reasons for why all of us are saying this. And certainly it can lead to vision loss, literally, right? Same thing with fake sweeteners, right? Not good. It actually, fake sweeteners will kill some of the good bacteria, right? We all have bacteria in our gut. This has become a real hot topic in the media. Will be killed if you're eating this fake sugar. And those good bacteria that are specifically affected by fake sweetener are the ones that are responsible for helping you digest sugars and keep inflammation down in your body. So it's like a double whammy, right? And so you have a lot of people who have diabetes or pre-diabetes, and what are they doing? They're using artificial sweeteners, which is actually making their diabetes worse. I don't know if that's a well-known fact, but every single lecture that I do for the public, I make sure at least somewhere I have my really bad food timeout. And so there it is. Throw it out. So, can vision loss be prevented? Sure, but maybe a few not so fun facts to realize, what's that all about? So, maintaining good if you maintain good blood sugar levels, right? So that really means a hemoglobin A1C, if you have diabetes, of lower than 7, right? And if you don't know what a hemoglobin A1C is and you have diabetes, I want you to run out and find out what that is tomorrow. But if you have good control, 90% of blindness could be prevented. So if you have diabetes, you hear, oh my gosh, you could lose a foot, your kidneys can go bad, you can lose your vision. All preventable, all preventable. That's exciting, but you need to obviously, really, is that really preventable? Is this not inevitable? It is not inevitable. You have a chance to beat your genes back. And I'm every day saying, yeah, I'm going to beat those genes. I know those bad little diabetes genes are in me. If you have a BMI, body mass index, you're overweight of 30, you're 2.5 times more likely to develop macular degeneration, right? So I think a lot of people think about, too much sugar, overweight, diabetes, but it also potentiates macular degeneration. That's a double whammy for some people. Guess what? Smoking increases a person's chances of developing macular degeneration by 2 to 5-fold. People with diets are elevated in fat, cholesterol, and high glycemic index foods. That means white bread, white sugar, white potatoes, and not eating your veggies are much more likely to develop diabetes, glaucoma, and macular degeneration. If you have high blood pressure and you don't exercise, you're more likely to have a bad outcome for macular degeneration. Some good news is that certain types of eye vitamins can actually slow or prevent the progression of macular degeneration. There's a special group of vitamins that's been studied for the last 2 decades, funded by the National Institute of Health, known as AREDS vitamins. If you have macular degeneration, and you fit the definition for treatment for this, you should be taking this group of vitamins. The age-related eye disease study vitamins. It's a specific formula. You may see this advertised on TV. They're all over the drugstores. I encourage people, though, to talk to their doc because there's a couple different concentrations of certain nutrients that could actually be harmful, such as zinc. So just be very careful. Make sure you get the advice of your doctor and make sure that you're collaborating with them to make sure that you're not just buying the random thing off the internet or shelf that really isn't truly an AREDS formula or doesn't have the right dose, as has been studied in these now famous studies. Eating leafy greens is associated with the reduced risk of developing not just macular degeneration, but also primary open-angle glaucoma. And having healthy teeth is associated with having better outcomes if you do indeed develop primary open-angle glaucoma. And insulin resistance itself, so having diabetes, can actually contribute to the glaucoma disease process too. So by now, I think you're probably getting a sense that all these things kind of go together, that being overweight, smoking, getting diabetes, puts you at a risk for getting all of the conditions that actually are the most common, most likely conditions to cause vision loss and blindness here in the United States. And you do have control over how the course of your disease will go. It truly is in your hands. Now, super easy for me to say that, super hard for you to be that. So, but I'm hopeful. I'm always hopeful. And, I know that you can do it. And I know that, it's just going to take one little spark somewhere, one little word somehow, and have it touch your heart and move what you do. Now, so we're going to talk about that too. But, something else that this is another sort of timeout I'd love for people to understand and know is that even though we have Medicare for people over 65, only about half of Medicare recipients actually receive an eye exam. So what I have learned here in my practice here in rural New Hampshire is that there's a misunderstanding that Medicare doesn't pay for eye care. This is not true. Medicare pays for eye care if you have the risks that I talked about, or if you have visual symptoms, or your vision is changing. If that's your chief complaint and your doctor finds a problem, absolutely that becomes a medical visit, and Medicare does, by and large, cover the cost of that care. At least if it's outpatient care, at least 80% of that cost is covered. If you have Medicare and Medicaid, typically 100% of the cost is covered. If you have Medicare Advantage plans, same thing there. And in fact, some of those plans are extending some of that coverage. So really understand your insurance and make sure that you're not going to the eye doctor on a regular basis because you think you don't have coverage, especially if you're over 65. This is a misnomer that drives me cuckoo. So quick COVID timeout. We're running down on the hour here. I want to make sure we leave time for our sponsors and for questions and answers. But what's happening with COVID? Yep, too much screen time, too much sitting around. My youngest son has had a lifeline to the refrigerator that I've seen nothing the likes of. We're staring at these screens, dry eye syndrome's worse. Your diabetes could be worse because you're not getting the exercise. Same thing with macular degeneration or glaucoma. Kids are having trouble with learning and concentrating because we're staring at these screens just like we are tonight. But really, prevention of all these eye conditions in a pandemic means stomping out the pandemic. And so that's my COVID timeout message tonight. So make sure, please, folks, that you follow the CDC practices. I don't care what the news says, really hand washing, standing 6 to 10 feet from people, wear your mask, and getting vaccinated is going to help us stomp out this, which is going to help prevent vision loss. There are people not going to the eye doctor. There are people not going to their regular doctors. There are people getting sick. We know that we can identify COVID in the eye. These are some images from the Serpico study that say, yeah, we might even be the person to identify COVID in asymptomatic people. Who knows? We're still learning about this. Please go to vaccinefinder.org and make sure you get your vaccine. Super important. So in the end, the father of medicine said, let food be thy medicine and medicine be thy food. We know that the Mediterranean diet, even the Asian diet and some other diets really are miracles. If you eat fruits and veggies and fatty fishes and nuts and seeds, foods of the earth, the chances of you staving off vision loss goes up precipitously. So go and learn about what the Mediterranean diet is as an example. There are others out there, and believe that you can change your destiny by using food. And what I'm telling you tonight is actually not different from many, many other really important groups. The American Diabetes Association, the American Heart Association, the CDC, and many others we all have the same dietary advice. It's just a matter of what organ are you going to affect. I have a complete and total bias that I don't want people going blind. What are some other crazy things that are really startling facts? Nearly, if you look at the American diet, nearly every person in these major surveys failed to meet recommendations for dark green vegetables, orange vegetables, legumes or beans, whole grains. And so what does that mean overall? That means overall that nearly the entire US population consumes a diet that is not on par with any of the recommendations that I might propose or all the other important medical groups. And that's disturbing, right? We know about our obesity crisis. We know that we're sucking down sugar at a crazy rate, and this is killing us and literally causing vision loss and blindness. In the 1820s, as a population, we consumed almost no sugar. We're up over 100 pounds per person as of the date of this major study here. It's crazy. There are other things like taking too much calcium, fried foods, the stress that we have in our modern lives, excess copper or iron in our diets, excess sugar, smoking, all these things can really add up to putting us at a very high risk for the conditions that cause vision loss, but we can control and beat back every single one of those. One of my favorite vegetarians, Dr. Michael Greger, I am not necessarily a proponent of becoming a vegetarian, but he's got a great book about how to incorporate the healthy fruits and veggies and fibers into your diet. They're going to help you not lose your vision and maybe not die. In the future, we're going to know more about our genes soon, which is now. We can identify genetically what some of the conditions are that we may be at risk for. And you're going to see all kinds of stuff coming out about that in the future years. Some doctors are doing some genetic tests in their practices now. And I think there's going to be some value to how that plays out, which means maybe we'll be able to identify who's at risk just by their genetics or a little drop of blood from their finger, which is very exciting. There's lots of information in the public for how to live a more healthy lifestyle. I think there's like 200,000 different health apps. These are some of my top recommendations, depending on what it is that you're trying to change. And I would strongly encourage everyone listening to just think about changing one really tiny, small thing tomorrow. And if that one little small thing is just making sure that you drink enough water tomorrow, I would consider that a great success. And slowly learn what are the small changes you can make in your life to be healthier. So I'm sure there are a number of people listening who do have macular degeneration, have been diagnosed. And so, what do I do now, right? Well, there are a couple of measures that can be very helpful in helping you understand, for example, are you getting enough fruits and vegetables in your diet? Because fruits and vegetables and the concentration of fruits and vegetables, we can actually measure that in your eye through a really interesting technology called heterochromic flicker photometry, more commonly known in the field as macular pigment optical density. But, the bottom line is, are your fruits and veggies getting up into your eyeballs to protect you from macular degeneration, from diabetes, and even glaucoma? This is a test that some eye doctors have in their offices. This is a screening test that we do on everybody over 50, for example, in my office. I use it as a way to give patients feedback and also to learn about them. So I make sure I'm spending the proper time with them talking about, so are you eating any broccoli or any spinach? Are you eating any vegetables ever? Today, yesterday? It's amazing what happens in the conversations, but I take it as an opportunity to say, hey, this machine is telling me you're not doing so good on your diet. Let's talk about that. There's another really amazing tech, and some eye docs have this in their office as well. I just ordered mine, very exciting, but this is a test that can identify macular degeneration before you even develop. So if you're listening and you have macular degeneration, have your children think about getting this test. And I'm really talking about adult children, not necessarily young children. Make sure that they see a doc who understands this technology and who can run this test. There's only one version on the market, and Adapt DX is the name of the technology. And the artificial intelligence on board this device is called Thea. She's a nice lady. Make sure your doc is really doing a high-tech examination. Most docs, a majority of docs have something called OCT, or ocular coherence tomography, in their offices. This device allows us to see the finest little detail in your retina, in your macula, to include the earliest signs of wet macular degeneration or a leak in the small blood vessels of the retina. Very, very, very important to identify those structurally. I would say even more important is checking your own vision at home with the most sophisticated device that's out there, which happens to be, in my opinion, this particular device, the 4C Home. And I prescribe this to all of my patients with macular degeneration, as long as they're of sound cognition and can physically manipulate the test. But this is it, and our sponsor is going to talk about this at some length. So I'm not going to talk about it too much, but I want you to be aware that high-tech doc and some high-tech at home can really, really, really make sure that you're getting treatment at just the right stage, regardless of the fact that you may already have macular degeneration. So don't forget, watch for symptoms: blurry vision, change in vision, distortion of vision, flashes of light in vision, things floating in your vision, eye pain, eye redness, anything new. Go see your eye doc. I always say safe rather than sorry. So in the end, follow a heart healthy diet, eat your fruits and veggies, seeds, proteins, healthy fats. That means fatty fishes and things like walnuts. Exercise, get off the couch, do anything, go up and down the stairs if you are able. There are alternative forms of exercise if you are not able to use your hips and your knees and legs. Yes, meditation works. Yes, sleep is healthy and helps you maintain actually a normal BMI and normal other circadian rhythms, which, believe it or not, has been linked to improved vision or a lack of vision change. Get out those sugars, fake sugars and trans fats. Wear your sunglasses. Wear blue light blocking glasses if you're spending time on the computer like me and everybody else. Use supplements, vitamins, if your diet is poor. If you don't want to change your diet, though I strongly encourage you to do that. Never smoke, and read that Ocular Nutrition Society in my waiting room is what I always tell my patients. So a couple books that I would recommend that you can start with is the Complete Eye Health and Nutrition Guide, Eye Foods, and The Visionary Kitchen. Great reads. Are cool stuff in there, great stuff. Multiply the power of your knowledge that you've gained, which I hope is a little tiny bit tonight. Parents and grandparents, you can help. If you have children and grandchildren, share your diagnosis of diabetes, of macular degeneration, of glaucoma, so that they know their risk. Tell them to cut that smoking, put away the fake sugars, and get off the devices. Yes, you can share the pathway to good health. An ounce of prevention, I always say, is worth a pound of cure, and it's never too early. This beautiful little baby is my first grandchild, and she's at risk for all kinds of things. But if I have anything to say about it, we're going to change her pathway, and this little girl is going to have great vision for the rest of her life. After all, as was said in the oldest Chinese text, medical text, first medical book, superior doctors prevent the disease, mediocre doctors treat the disease before evident, and inferior doctors treat the full-blown disease. I know which doc I want to be, and it's one helping you. Yes, prevention of vision loss is our mission. Thank you very much for your attention. Yeah, I see those questions and answers. Sure, I'm going to just look at a couple of these. One question, you mentioned that your grandmother lost her sight to both diabetes and macular. I thought you could only have one or the other. Well, I'm sad to say that you can have both diabetes and macular degeneration, sadly. So I wish there was another answer for that. So another one, I've always heard eyes are the window to the soul. However, I learned that eye diseases can show other diseases. Yes, thank you very much for that comment. Another question, I had lupus and had to have very strong steroids and then developed diabetes. Does this affect the eye in the same way? The answer is yes. Once you develop diabetes, regardless of the reason you develop diabetes, your risks and your treatment pathway becomes the same. So for you, controlling your blood sugar is just as important as somebody who's developed diabetes for because they're overweight, for example. But, there are people who are normal weight who develop diabetes. That's why you really have to make sure you're looking at your whole risk. And if you're underweight, you eat fruits and veggies, maybe you might develop diabetes later, but it doesn't mean you're not at risk if you have the genes. So, like I said, everything I'm saying is in generalities. Which doctor should I be seeing? A regular eye doctor or a specialist? My eyes seem fine. Go to the closest family eye doc. Usually it's a doctor of optometry if your eyes are fine and your vision is good. These are doctors. They're trained medically, just like eye surgeons. They go to 4 years of pre-medical training and 4 years of specialized training in the eyes, and many go on to do residency and fellowship, just as I did. They will get you to a specialist if that's needed. The one thing that you don't want to do is go to an eye surgeon for comprehensive care, because we don't have enough of them, especially in the rural Outer Banks. So we want you, going to the right doc at the right time for the right treatment. Start with your doctor of optometry. Really, really important. Another question. On my OCT, my right optic nerve is bigger than my left. I also have tilted disc on the left. Would you please elaborate about what vision complication I may encounter in the future? So here comes a disclaimer. It's hard to know. Some people are born with asymmetric optic nerves, just because that's how they developed. Sometimes that means you're at a higher risk for developing glaucoma. So you need to ask your eye doc that. So if you know that and you've had an OCT, your eye doctor should have had a conversation with you about your individual risk and some of the other things that in your medical history that may or may not put you at risk. I suspect that person is also very nearsighted. Without having a genetic test for my eyesight, when should I have it done? So, this person might have come on a little bit later in the presentation, but depending on your age, the recommendations will be different. So I would encourage you to go to AOA.org. All of the recommendations are there, AOA.org. This is a really important question, actually. I'm afraid of getting the vaccine as I heard it can hurt my vision. There's absolutely, and I just wrote a long editorial about this. As far as we know, right now, there are zero cases of someone losing their vision or developing a condition that would cause them to lose their vision as a result of getting the vaccination them itself. So that is not a reason to be fearful. And please go talk to your primary care doctor or even your eye doctor, anybody, and they will be able to give you the exact information as well as run you through all of the questions that the CDC has recommended for figuring out who might be at a little higher risk for getting some side effects. And, just another quick COVID timeout, just so people get some numbers in their head. With the Pfizer vaccine, for example, out of 1 million doses, the first 1 million doses beyond what they did for the approval of the drug, there were only 21 adverse reactions or allergies. And out of those 21, there were only 3 people who, got swollen lips, get little trouble breathing, called anaphylaxis. So the risk of getting a reaction from the vaccine is lower than getting dead from COVID. So you have to balance that out. So think about that. So another question, if you have wet AMD and are getting injections, how good are these medications at maintaining your vision, the vision you have, and what can we be hopeful for down the road? Obviously, diet, exercise are beneficial. Once you have wet AMD, can you still have it not get worse, I think is what the question is. So the answer is yes. Even in the age-related eye disease studies, there's strong evidence that eating fruits and vegetables and taking the AREDS formula along with omega-3 fats can help prevent vision loss in the other eye if it's not wet. And it helps slow vision loss in those who have developed wet macular degeneration. Now, we don't have good evidence that will be reversed, but absolutely, it is absolutely critical to maintain your healthy diet, your healthy weight, eat your fruits and veggies that are rich in carotenoids. That's the color in fruits and vegetables. called lutein and zeaxanthin. So for example, spinach and egg yolks. All right, let's see. 4C Home, even if you already have wet AMD, absolutely. Something is a large medical center and they say they won't use it. So how do you get one? Stay tuned because we're going to have a presenter in just a couple of minutes who will help you get to the right person to help you get that technology. And does being on the computer or phone make macular degeneration worse? Great question. We know that the blue light that comes from the sun and is the same blue light that comes from the computer. The studies are a little bit inconclusive, but of course they are because we haven't had enough time to study millions of people staring at computers in a way that's meaningful. So what I tell people is we know what the sun does. We actually know what blue light does. It creates a genetic change in the retina that's very bad. And so knowing that about the physiology, what I tell people is we don't have the answers yet, but please get the blue light out of your computer until we know otherwise. Wear sunglasses. My glasses here have blue light blockers so that even though I'm staring at this box and probably will be for some additional time, I'm still going to get some protection. I also put the nighttime settings on both my computer and my cell phone. And there's also another product on the market. There may be others. The one name brand that I happen to know is OcuShield. It's a clear screen that you can put on all of your devices. So definitely work to keep the blue light away from your eyes. So last question. What prescription and over-the-counter medications should you avoid if you have wet macular degeneration? I'm not going to list specific medications because you may be on medications that are life-saving that you should not come off of. There is a mix. There's a debate about whether or not older people who haven't had a heart attack should be on aspirin, for example. The person was asking about aspirin. There are new standards for who should not be on statins. I'm happy to give individual advice about that. I try not to give general advice in that regard, but aspirin and statins are certainly two drugs you need to talk to your doctor about. If you do not meet the risk profile to be on those medications and you have macular degeneration, that is a legitimate question to bring up.
Now I want to introduce one of my favorite subjects, and that's the Megan Blemker, who's going to talk about 4C Home, which is my favorite device. I'd show it to you. It's just to my left. I use it every day, and it's probably the best thing you can have. So it's now my pleasure to introduce our next speaker, Megan Blemker. Megan is an ocular disease residency trained optometrist who practiced in Nashville for 9 years before transitioning to industry. She now works for Notavision team a little over 2 years, where she serves as a director of clinical affairs and professional relations. So my pleasure to introduce you again, Megan.
Thank you so much, Larry. I really appreciate the introduction. And also thank you for sharing your personal eye health story with age-related macular degeneration. And wow, what a wonderful presentation indeed from Dr. Hitchmoth. And thank you to everyone who's attending this evening. I appreciate the opportunity to be able to speak to you this evening. And I'll just pull up my presentation here. Hide so you can see. So I want to reiterate some of the very important points that Dr. Hitchmoth made in her outstanding presentation and further discuss how you can play a role in protecting your vision by understanding the importance of early detection of wet AMD. So we'll talk about 4C Home, which is an FDA cleared and Medicare covered technology. It is prescribed by your eye care provider when you have the appropriate level of vision and the appropriate stage of age-related macular degeneration. And it's a form of personalized medicine with the 4C Home device being used at home in between your regular eye exam. So in addition to the way your doctor is already recommending you're monitoring your vision. And the way it works is by detecting metamorphopsia, which is visual distortions that occur in age-related macular degeneration. AMD, or age-related macular degeneration, is actually the leading cause of severe central vision loss in people over the age of 50 years in the United States. I know that both Larry and Dr. Hitchmoth talked about how prevalent this is past a certain age. And I'd like to share with you the information you need to become more informed and take charge of your vision, in addition to the wonderful ways that Dr. Hitchmoth described as far as caring for yourself, caring for your health, and thus caring for your eyes. And AMD is a chronic condition, meaning it doesn't resolve, it doesn't go away, and it's progressive, which means it tends to worsen over time. There are the two types, the dry and the wet type. Dry is that slower changing, earlier form of the disease, and it puts you at risk for developing wet AMD, which is the sudden change or more advanced form of the disease. And it affects the area of the retina called the macula, which I know Dr. Hitchmoth showed you all of the wonderful parts of the eye. There's a lot going on in that little space, a lot of important parts working together. So we're talking about the area of the retina called the macula, which is in the back, responsible for that detailed central vision used for activities like reading and driving and seeing faces clearly. And what happens in dry AMD is there are changes that occur in the cells of the macula, and drusen, or these little yellow deposits that are in the circle there, build up in the area. And these changes within the retina can actually induce blurry vision, such as difficulty seeing sharp details, both up close and far away. And again, since dry AMD is the slow form of the disease, changes that occur with your vision, you may not notice over time. And more importantly, the dry form of AMD puts you at an increased risk of progressing to that wet form of AMD. And over time, the size and the number of these little yellow deposits, these drusen, can increase, which increases your risk of developing this more sight-threatening form, or wet AMD. So again, dry AMD can suddenly change without any kind of notice to the wet form of AMD. So if you convert to wet AMD, abnormal blood vessels actually grow under and into the retina. So this image here on the right side of the screen, this is still in that area of the back of the eye, the retina, called the macula. And what happens with these blood vessels is they're leaky, and they can leak fluid, and they can sometimes bleed, again, without any type of warning. And so you may not notice the changes until, unfortunately, significant vision loss has actually already occurred. And if you do convert to the wet form of AMD, this can be rapid and it can be severe. Symptoms include distortion of your vision, which means, straight lines can look wavy. You can have dark spots in your vision and just have generally blurry vision, as you see here on the screen. And unlike dry AMD, there are actually effective treatments for wet AMD. But the important thing to note is that these treatments are most effective when they are administered early on, before you notice symptoms and before any vision loss has taken place. And while they can halt or slow the progression of wet AMD, they unfortunately can't restore vision that's already been lost. Because once the wet disease starts, it will continue to advance until you receive treatment. And then that irreversible damage can occur, within days or even weeks before symptoms are noticed. But when we say early, how early is that detection? Well, once the symptoms take place, where those wavy lines appear or the dark spots appear in your vision, then the vision loss may have already occurred. So the earlier you catch wet AMD, the better chance you have of preserving your vision and preserving your independence and being able to go about your daily life and participate in the activities that you enjoy every single day. Again, early detection is key. So wet AMD treatments essentially are most effective when the disease is caught early. And we have an early warning system for your eyes. It's called the 4C Home. And you use this device at home in between your regular eye exams. And it helps people with dry AMD detect wet AMD before you even notice that any of those visual changes have taken place. And the way it works is you take a simple daily test that checks for these tiny changes in your vision. And it just takes a few minutes per eye per day. And there's an image of the device here on the left side of your screen. And then once you take the test, that data from the test is sent to your eye doctor, and it's sent to our No Television Diagnostic Clinic, which is the medical provider of 4C Home. And the system, if a change in test scores is detected, then the diagnostic clinic alerts your doctor when the system notifies the clinic. And then your doctor's office will contact you directly to schedule a follow-up visit and examine your eyes. So we talked a little bit, there was a question I believe as well about the Amsler grid. This is something that was developed in the 1940s. It's essentially this piece of paper over here, this arm, this hand that's holding this grid pattern. And it's for a long time been recommended as just a simple and accessible tool that you can use at home to monitor for changes in your vision. But again, unfortunately, by the time you notice vision distortions on the Amsler grid, significant vision loss may have already occurred. And so fortunately, we have this newer technology, the 4C Home AMD monitoring program, which has been developed to detect those tiny changes before symptoms are even noticed, and again, reports them to your doctor so that you can receive that immediate exam and possible treatment. So testing with 4C Home is very easy. You essentially plug in the device and you turn the device on. You'll look into the viewfinder here to begin the testing. And you take this very simple test by looking into the screen, and you'll see in the center here, there's this green circle. You will look at the center dot, and then a bump is actually going to briefly appear and then disappear. And what you'll do is you'll use the mouse that's provided with the 4C Home to click where you think you saw the bump, and then you'll come back to the center dot. So you'll just repeat that over a series of lines with bumps that are presented to you. And then your results are sent. The data from each test goes to the Notal Vision Diagnostic Clinic, and that data is evaluated and then again provided to your eye doctor. So similar to the other healthy habits that Dr. Hitchmoth talked about today, even a mention of, dental hygiene, just like you brush your teeth every day, regular at-home monitoring is a good healthy habit that you can do to help preserve your vision. 4C Home allows you to take the proactive approach to protecting your vision. And one of our clinical partners is going to be with you every step of the way. So after our Notal Vision Diagnostic Clinic receives the referral from your doctor, our team's going to answer any questions, they'll verify insurance coverage, and then ship the device if you have accepted moving forward with the AMD monitoring program. And once you receive the device, then our same Notal Vision Diagnostic Clinic will actually walk you through the setup, walk you through the training. They're on the phone with you. Again, they're with you every step of the way during the setup process. And then you and your doctor will continue to receive that feedback from our Notal Vision Diagnostic Clinic. Before you even receive the device, our team is actually going to be sure to verify your insurance benefits and discuss with you again to see if you'd like to accept and move forward to get started with the program. We have low out-of-pocket costs for Medicare patients because the technology is FDA cleared and Medicare covered. So patients with Medicare plus a secondary supplement plan may not have an out-of-pocket cost every month. And then patients with Medicare and no secondary supplement plan pay around $15.03 per month once your yearly Medicare fee-for-service Part B deductible is met. But again, our team's going to go through all of that before we ship you the device and walk you through getting started. So your doctor essentially sends our Notal Vision Diagnostic Clinic the order for you to begin the 4C Home AMD monitoring program, and then appropriate candidates. This is of important note. Appropriate candidates for 4C Home actually have a particular stage of dry AMD and an appropriate vision level, which those are both things that would be determined by your doctor. So you'll continue to test regularly at home, and if a change takes place, your doctor will be alerted, and then we'll have you come in for the examination. So in summary, our Notal Vision Diagnostic Clinic works with your doctor remotely to monitor your dry AMD in order to help you retain functional vision throughout your AMD journey. And of course, I'm happy to answer any questions you have about 4C Home, and really appreciate your time and your attention. So thank you so much. So the first question, if I am taking the test, but I'm late in responding, can this be a false reading? This is a wonderful question because the artificial intelligence, the way the device works is you'll start testing from the beginning, you'll establish a baseline, and that is when you are learning how to use the device, and then the device is learning what your starting point is because it's customized for each person. So if you have a test that you don't feel like you did very well on, or maybe you're not having a great day, the dog barks, the phone rings, or it's just not your best work, absolutely no worries. the test will take that into consideration. There's actually a series of tests that you would have trouble with before the system would actually alert our clinic, and thus we would alert your doctor. So it definitely takes that into account with the learning curve, and that we're human and that things happen whenever you're taking a test every day. How easy is it to use this machine? So with technology, sometimes that can be a bit intimidating, I think, when you're first learning about the possibility of having some computer or device in your home. And it's actually very easy. We like to say that it's a plug and play type of system where you essentially, and again, our team is going to be calling you. They're going to be talking to you as you're getting things set up. They'll be talking to you on the phone, but you'll take the device out of the box. It weighs about 3.5 pounds, so it's very lightweight. It's very easy to maneuver, and it only comes with that viewer and the mouse. So, and then it will plug into the wall. So that's all you have to do is have it plugged into the wall. And then when you're taking the test, as you look in the viewer, you could just click the mouse with your finger, and that's essentially the effort that it takes to perform the test. But again, our team is there to be with you on the phone, answer any questions that you might have, and just support you throughout the process. Can I get this without my doctor having to order it for me? This does require an eye care professional's prescription because, again, you have to have the appropriate level of vision and the appropriate stage of age-related macular degeneration. Next question is, what if you already have wet AMD? I asked my doctor about this device and he said they won't use it. I would love to try one of these. So again, kind of a two-part answer here as far as the indicated or the intention of the device or the indication for use for this type of technology. So it is for dry, intermediate stage, age-related macular degeneration patients. And so the two-part answer includes the most important part, which is the artificial intelligence or the technology that it utilizes is actually trained to detect when there's that conversion from the dry to the wet kind. So it's not as effective for someone who already has wet AMD. The other reason is because of the indication and the Medicare coverage that it has to be a dry AMD diagnosis for insurance to cover it. Next question, I think I answered. There's another question about, can you use it if you have wet AMD? Certainly for a fellow eye. So if you have one eye that has wet age-related macular degeneration and the other eye has dry age-related macular degeneration, you can certainly use it on that dry AMD eye. Definitely you want to protect both eyes, but especially if you have one eye that's already affected, of course, you're a little bit higher risk for that fellow eye to convert as well. And you want to do everything possible to preserve the vision over there. So it can be prescribed for one eye or both eyes with dry AMD. So great questions.
I want to thank Dr. Blumker and Dr. Hitchmoff. They're just fantastic presentations. Please continue to watch, go to the Macular Degeneration Association website where you'll see future programs. And I thank you all for attending, and best vision to all of you.